This is the flagship breast cancer meeting in the world.
Because it brings the whole team together, not just the medical oncologist or the surgical oncologist.
Huge audience, great faculty, great venue.
But also the radiation oncologist and the plastic surgeon.
They should come here ready to learn.
Up-to-date topics.
Clinically relevant.
And there's a lot of audience participation.
The best speakers and thought leaders in the world.
I've been coming for the last 5 years every year. This is my first time here.
I love to come here because it tells me what to do in my practice the next day.
We live by the motto, hear it Friday.
Use it on Monday.
What you hear on Friday.
And can use them on Monday.
And doing the best by our patients. There's no better vehicle than Miami.
There's no substitute for a live meeting. And this is really one of the best live meetings in terms of the faculty that we get together.
At the end of every session, we're sort of inundated with friends and colleagues that want to talk about breast cancer and talk about cases.
Allows for multiple opportunities for audience members to interact with faculty members who are world-class experts in their field.
It's a very efficient way to learn, I believe.
Versus a virtual meeting.
Location is fabulous. The talks have been wonderful. They're very succinct and to the point.
I learned a lot of things. I think it'll be really useful for my future.
You can't just stay in your own area. You really need to hear from all the different disciplines and be able to hear how they respond to the different questions that are asked about how they approach treatment. The whole team, the panel discussions are usually very rich.
Opening up these Meet the Expert session case rooms where the attendees can come and meet with the steering committee and present their own cases.
And can really compare information, notes on how to treat patients.
By having all of the experts and thought leaders discussing them.
Be able to implement the things that they're recommending.
And really the driving spirit behind everything that we do is the patient. So this year for the keynote speaker, we continue to have a patient because of such great feedback we've had.
To really stand on a stage in front of professionals from around the world who've dedicated their lives to helping people like me is a really humbling experience. I was 31 when I was diagnosed. If you can give your patient the worst case scenario, why can't you give them the best case scenario? Giving hope can be so healing, and I can attest to that because Dr. Borgen's hope is what gave me hope and saved my life.
Every year we have this big reception out on the lawn where there's music, there's dancing, but it gives you that chance to walk around and really mingle, network with your peers.
Networking events where you really begin to get the material and understand what's going on well before it's published is absolutely essential to being able to do what you need to do very well.
I can't think of a better place in the country.
I really enjoyed getting to know the other faculty members. I bring my family.
I looked around for different meetings, and this was the one that offered the best opportunity for surgery and oncology.
There's a good mix of panel discussions, case presentations, so that you really get to hear all sides of the story.
The lectures that were given this morning by Dr. Rugo and Dr. Mittendorf really summarize the current state of immunotherapy.
And it's also very, very nice to have all the thought leaders coming here to share with us all the news.
Today, atezolizumab was approved by the FDA. So the meeting actually took place at what I think ultimately will be a historic time in the treatment of breast cancer.
I'm definitely going to be coming back next year.
Of course.
I do plan to come back.
Just as breast cancer continues to advance, this meeting continues to advance.
In 4 days, you get a panoramic view from genetics to prevention to radiology, radiation, surgery, medical oncology.
We'll continue to refine the educational design. We'll continue to add new formats, create new opportunities for networking, best ways to hear about your cases to make sure that you're providing state-of-the-art care to these patients. I hope you join us next year in Miami. It's going to be great.